start with placing the chest and lead electrodes. We need to determine the area first. We need to avoid those muscular and bony areas and choose those flat and fleshy area. And after that is to identify if the ankle and the chest area is hairy. So if it's hairy, we need to consider, or we need to ask permission to the client to clip the hair or to remove or shave it to appropriately place the electrodes. So let's start with cleaning the area first. So we need to clean the right arm with water and soap. So here, then after that, we need to dry the area, and then wash the other hand, then also dry it. Okay. Then next to the leg and dry. So you can use the back and the front portion of your washcloth. So also after drying the right leg, wash the left leg. And after dry it also. So we're done with cleaning the area.
Apply the limb lead electrodes. The tip of each wire is lettered and color-coded for easy identification. The white or RA goes to the right, RA lead goes to the right arm. The green or RL lead to the right leg. The red or left LL lead to the left leg. The black or LA lead to the left arm. Peel the contact paper off the self-sticking disposable electrode and apply it directly to the prepared site as recommended by the manufacturer. Position disposable electrodes on the legs with the lead connection pointing superiorly.
Now let's proceed to placing the limb lead electrodes. So for our first lead, the white, that will be placed on the right arm. Sir, excuse me po. So we need to make sure that when we place this metal or these electrodes, there should be no metal around the area, or we need to remind ourselves that we need to remove those watches or bracelet, any metals that could interfere with the result of the ECG. The next is the green that will be placed on the right leg. So to the right leg, excuse me, sir. The next is the red that will be placed on the left leg or the left ankle. And after that, the last one is black, will be placed on the left arm.
Connect the limb lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright.
Next to place is the limb lead wires.
Expose the patient's chest. Apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 to V6 leads are applied to the chest. Peel the contact paper off the self-sticking disposable electrodes and apply directly to the prepared site as recommended by the manufacturer.
So after we place our the limb lead wires, next to be placed is the chest electrodes and the chest precordial lead wires. So expose the chest area. Ask permission to the client, sir. Sir, ibababa ko lang po ito kasi maglalagay tayo. Okay, sir. So make sure that you drape the area that is not that is not part of our procedure. Then so I'm done with cleaning and washing the area. Now I am able to place the chest lead electrodes or chest electrodes. So for the V1, it should be placed on the fourth intercostal space of the right sternal border. So in locating for the right sternal border and for the fourth intercostal space, starting with the sternal notch. So in locating the V1, we will start first at the sternal notch. So the sternal notch is located at the center of the in between the clavicle. So there's an indentation here, and then below this sternal notch, we will locate the sternal angle. So the sternal angle is the protrusion. We will feel the protrusion here, and then we will move to the right side. So in the right side, we will gonna locate the second intercostal space. Now we're done locating the second intercostal space. Move to the third. Move to the third and to the fourth. Okay. So it's the fourth intercostal space. We will place the V1. Since I'm done with cleaning the area and drying it, I'm now able to place the B1. Then next is the V2. V2 is just located at the opposite side of the sternal border at the left side of the fourth intercostal space. So same procedure, the sternal notch, and then locate the sternal angle on the left side, third, fourth. So the fourth, after placing the second or the V2, next locate for the B4 first before locating the V3, since it is easier for us to place the V3 because it will be placed halfway between the V2 and B4. So first we will locate the B4. The B4 is located at the mid-axillary line of the fifth intercostal space. So same procedure. Locate the sternal notch, then next sternal angle to the side, second, third, fourth, fifth. So we need to make sure that it is on the mid-clavicular line. Okay. Mid-clavicular line. Next is to place the V3. The V3 is located just between the V2 and the V4. So place it here. Then next is to locate the V5. The V5 is located at the fifth intercostal space. At the fifth intercostal space, same with the B4, but it is on the anterior axillary line. So on the front part of the axilla. So it's here. So it's the fifth intercostal space. Okay, place it here on the front. And then, okay, on the front. And then, the last V6 is located in between mid-axillary line. Same level with the B4. Excuse me, sir. I'll just gonna place it. Ilalagay ko lang po ito. Okay, at the mid-axillary line. So, now we're done with placing the chassis electrodes. So, the V1 is at the fourth intercostal space at the right sternal border. Same goes to, same with the V2 located at sternal border at the left side of the fourth intercostal space. And halfway of B2 and B4 is the V3. Then the B4 located at the fifth intercostal space. Then B5 at the the anterior axillary line. And lastly will be our V6. So proceed with the placing of chest precordial lead wires.
Connect the precordial lead wires to the electrodes. Make sure the metal parts of the electrodes are clean and bright.
So place the precordial lead wires. Then we will place a tape here to keep it in place.
After the application of all the leads, make sure that the paper speed selector is set to the standard of 25 amp per second and that the machine is set to the full voltage. If necessary, enter the appropriate patient identification data into the machine. Ask the patient to relax and breathe normally. Instruct the patient to lie still and not to talk while you record the ECG.
Sir, relax ka lang po. Huminga po ng maayos, ng tama, at saka po, huwag ka pong magsasalita pag nag-start na po tayong mag-record.
And then press the auto button. Observe the tracing quality. The machine will record all 12 leads automatically, recording 3 consecutive leads simultaneously. Some machines have a display screen so you can preview waveforms before the machine records them on paper. Adjust waveform if necessary. If any part of the waveform extends beyond the paper when you record the ECG, adjust the normal standardization to half standardization and repeat. Note this adjustment on the ECG strip because this will need to be considered in interpreting the result. When the machine finishes recording the 12-lead ECG, remove the electrodes and clean the patient's skin, if necessary, with adhesive remover for sticky residue.
So after the machine recorded the 12-lead ECG, now we can remove already the chest electrodes and limb lead electrodes. And after removing the electrodes, we need to clean the area. So sir, tanggalin na po natin kasi tapos na po. When we remove this, discard the disposable self-staking electrodes. So discard. Remove the limb lead electrodes. clean the side, the chest area, as well as the ankle and the arms. Upper arms. Okay. So, linisan ko lang po ito, sir, para hindi po masyadong malagkit or madikit. Okay. So, use the back part. And then, get another adhesive remover. Okay. Now, we're done with cleaning the area or cleaning the specific side. After disconnecting the lead wire from the electrode, dispose of the electrodes. Return the patient to a comfortable position. Lower bed height and adjust the head of bed to a comfortable position. Next is to drape the compliant, provide comfort, clean ECG machine per facility policy. If not done electronically with the data entered into the machine, label the ECG with the patient's name, date of birth, location, date and time of recording, and other relevant information such as symptoms that occur during the recording. Remove additional PPE if used. Perform hand hygiene. We're done with providing the client with the ECG. Perform hand hygiene, remove the PPE. So, in removing the PPE, first will be our gloves and discard. So, after discarding that, we wash our hands and document our care. And document also the procedure and refer